Ladies and gentlemen, thank you very much for opportunity to talk about the topic, what needs to change to make the TB elimination a reality. In today, we celebrate the World TB Day. My talk will mention about the current situation of tuberculosis, what is the gap of the TB detection and treatment, the role of community, what need to change, the new model of the TB control. As we know, tuberculosis exists very long time, more than 140 years after we found the bacilli of tuberculosis. But until now, it's more than 10 million people still got tuberculosis 1 year, and more than 1.6 million people dies of TB in 1 year. We look back for the tool for detection and the drug for treatment. WHO have a guideline for all of aspects of tuberculosis control, from the prevention, screening, diagnosis, treatment, and management in the special age group is children and adolescents. This is a quite difficult group for the tuberculosis practice. So we can see that the tools for detection and drug for treatment are available. But still people suffering of tuberculosis and dying every day for tuberculosis. We can see here the detection treatment gaps are major reason. If we compare to the United Nations high-level meeting targets, last year, only 66% of the tuberculosis patients are treated. And if the children, only 54%. For the multi-drug resistant tuberculosis, it's even lower. For the TB preventive treatment targets, also far away from the target. So what is wrong? We can see from 2 points of view. Number one, from the TB care providers, try to provide the people with the TB services, including the test for diagnosis, drug enrichment for treatment, guideline for prevention, on the TB facility and mechanism, how the people to assess. And other point of views, from the TB care clients, which we can say, especially vulnerable population. In many regions, they cannot access to the service. Many problems are available of service, accessible of service, affordable of service, or accountable of service. Depend on the 4 innovation of thinking of people, the technology, the approaches, or investment. From population point of view, we see it's not adequate. Knowledge, attitude, practice might be limited information, ignorance, subjectivity, difference, stigma, discrimination, economic barrier, poverty. So the question is, why permanent tuberculosis? We can see the 2 categories of reason. Number one, objective, very difficult to change. The TB bacilli, TB bacteria is very special. And tuberculosis is social disease because a long history of the 4 incurable diseases, non-treatment regimen, and many drugs with side effects. And the second category of the reason is a subjective. We can change. Number one is passive community. If a passive community can consequently delay detection, so that it spreads infectious sources in community and no treatment. The reason we explained above. So the solution is how to make the community actively involvement in the TB control by complication innovation, effective advocacy, labor and poverty control, patient support program. The second is leadership, lack of awareness and concern of the leadership. Consequently, lack of resources, lack of mechanism, lack of monitoring and evaluation. Very fortunately, 10 years recently, we have new drug, new technique, new vaccine, and new approaches. Before that, we search for a long time, we have no. So this is change effectively. Based on that, and the lesson learned from the COVID-19 3 years recently, we proposed a new model of the TB control with the 40-60 PAM. 40%, we mean that we identify the two categories of the work for the TB control. The number one is medical works, occupied by 40%, including the examination, testing, checklist rate, assessment of the drug resistance, identify comorbidity, active case finding, intensify case finding for tuberculosis, indication of TB regimen treatment, drug to treat concomitant diseases, monitoring and drug response, reaction, treatment and comorbidity or adverse event, monitoring and evaluation microbiology, imaging testing for identified treatment results. And PAM stands for Practical Approach to Medicine by integrating practical management of chronic disease from the grassroots level, like asthma, COPD, pneumonia, high blood pressure, diabetes, HIV/AIDS, smoking cessation, rehabilitation. All of this must be done by healthcare workers in the TB and lung disease control and prevention network from central to local level, cannot empower the community. The second category of work is non-medical works, occupy about 60%, including the healthcare communication, recognizing signs of tuberculosis, connecting, motivating, guiding, supporting medical examination for the people, receive, support, and encourage patients who has been diagnosed for tuberculosis. Do the community-based healthcare, taking drug regularly, overcome with side effects, follow the treatment adequately. Working as a substitute alternatively for the patient live during the initial treatment period. Mental, economical, physical support. Connect online, contact the counseling team and medical facility when needed. Expand support for disadvantaged, vulnerable group. All of this can be done by the community, participation of the CBO, unions, association, society, policymaker, mass organization. We establish the COMMU, Community Support Network to end tuberculosis. To support community to be actively involved in TB detection, treatment, and prevention, Vietnam Lung Association established a network, so-called Community Support Network, to end tuberculosis. The short name COSINET. This logo of this organization with the 5 circles at the same starting point, moving from the left to the right on the green road with Vietnamese English name for appreciation. The brown badge gradually change the color from dark to light at the end. Seem to be the wave, which are milestone of tuberculosis being pushed back from the bow showing high burden. To paint color is a TB gradually decreasing to the end, in which nuclear is the VILA, Vietnam Lung Association. Identification of the communication support network to end tuberculosis with the vision, leaving no one behind because of tuberculosis. The mission as an extension arm accompanying the tuberculosis and lung disease control prevention network of the country and the National Lung Hospital in the process of ending tuberculosis in Vietnam. The core value, including the nation and understanding, kindness and scientific approach, solidarity, dynamism, responsibility, and efficiency, especially express happiness. What does that do? With the gold standard TB care for all, and nuclear is the active involvement of the community in ending tuberculosis. So activity including the media network, the TB medical service, mapping and contact, develop the guideline, training material, training, education, research, patient support program, monitoring, supervision, social mobilization, and management. And the network is opening for all the partner with the partnership. So far, we have so many partners is around. So we hope that all the partner, all the community can support us to achieve the goal and fulfill the mission. In conclusion, yes, we can end the tuberculosis, but we must be active more than 200%. We must get community to be active involvement in the case detection and management that needs to change. Thank you very much for listening.